Why is my period completely all over the place? It's sometimes 2 times a month, then I don't see it for 3 months. What the heck is going on with abnormal uterine bleeding in perimenopause? In this video, we're going to tackle one of the most common annoying symptoms of perimenopause, which is irregular periods and bleeding. We're going to go over what you should tell your doctor. We're going to go over what lab tests and what imaging is really helpful and what it means and potentially how you can treat it. So if you're interested, stick around. If you don't know me, I'm Dr. Hirsch. I'm the program director of the Menopause and Midlife Clinic at the Brigham and Women's Hospital in Boston, Massachusetts. But don't be fooled, I see women for perimenopause all the time. Perimenopause is having a little bit of a renaissance where women are starting to recognize that perimenopause is actually a separate thing from menopause. So what are the definitions? Well, menopause is when it's been 12 months of no period. And if you can't use your period or you don't want to only go by that, you can also see that there's an elevation in your follicle stimulating hormone level, or FSH for short. And it's generally over 35 on multiple occasions, and you've not had a period in 12 months. That is classic bona fide menopause. But perimenopause, which is the stuff leading up to that, can be a real drag, and it can last anywhere from 1 even up to 10 years. So it's not uncommon that in my clinic I'll have women who are, let's say 50, and they'll say, I swear these symptoms started in my early 40s. I started getting hot flashes and night sweats and my period started changing, but I didn't really think anything of it. And that right there is exactly what perimenopause is like. That estrogen level is starting to decline, and at the same time you're getting just really obnoxiously either heavy periods or very sporadic periods, which means that of course it comes on your vacation when you haven't had a period in say 2 or 3 months. So why does this happen, and what should you do when you talk to your doctor about it? So I definitely recommend starting with tracking and journaling. This is so important because perimenopause is truly a clinical diagnosis. And people say that a lot, so what does that actually mean? It just means that a clinical diagnosis is diagnosed clinically by what your clinician sees. There is no specific lab test or FSH value or estrogen value that can really cinch the diagnosis of perimenopause, to the dismay of many people. So you're going to want to start journaling and tracking. I like 2 ways, either an old school journal, because then you can open that page and I can really see what your periods are doing, or you can also check out the Balance app. The Balance app was designed by Dr. Louise Newson and her team in the UK, and I think it's a really great place for you to start tracking periods. And while you're at it, you should also track any symptoms. So night sweats, trouble sleeping, hot flashes, libido, mood, irritability, whatever it is that's bothering you, start tracking that. Also, things that you should know then is what is the length or interval between your periods when you're talking to your doctor. So you could say, well, looking at my trusty app here, I see that my periods are anywhere between 17 days and 64 days. What the heck? And that is classic perimenopause. As well as you might start to see trends. For example, I noticed that a week before my period, I can't sleep. I'm a complete insomniac. That is really helpful to know. It cinches that clinical diagnosis of perimenopause. Again, also let your doctor know how long are they lasting for, and are you noticing any clots or brown discharge or anything like that, because that can also be valuable, although TMI information. You know, what I like to do as a doctor when I'm looking at someone who is in perimenopause is just check a couple of basic labs, because there are other things that it could be. And so since this is a clinical diagnosis, you don't want to miss anything else. The most common being a TSH value. So even hyper or hypothyroidism can cause irregularities in your periods. So that's the most common thing that I might check for. I'm also going to check a CBC to make sure you're not anemic, especially if you're having prolonged or heavy periods. So I am going to maybe check some lab work. You might say, what about other hormones like FSH or estrogen? Sure, those can be helpful, but remember, that's not going to be so helpful in the moment. If you're having periods, I know you're not menopausal, but we can kind of also see what those levels are doing, especially if we're going to track them over time. So what causes irregular bleeding? Well, the most common is just the fluctuating and volatile hormones. So it's a hormonal based irregularity. And perimenopause seems to be this time of like these fireworks before menopause, where you might say, I never had painful periods or heavy periods or clots with my periods, but all of a sudden I am. That's very hallmark and classic, and that is that hormonal shifting. However, while we're talking about it, sometimes it's helpful to get an ultrasound. Now, ultrasound can see if there's any anatomical reason why you might be having irregular bleeding. So polyps or fibroids are really big culprits of this. Both of those increase the surface area of the uterine tissue. So it's just more tissue that's being stimulated by the volatile and changing hormones. But knowing you have that can be really helpful. It's also a great time to do an ultrasound, or when you're doing an ultrasound rather, to look at the ovaries and the lining of the uterus and just see that everything overall looks really healthy. Now, sometimes your doctor might want to do something called an endometrial biopsy, and that's when they've done the ultrasound and they're looking at your bleeding and just want to ensure that the lining of the uterus is healthy. The reason we often do an endometrial biopsy is to just confirm that this is hormonal, because again, there is no great test that really cinches that. So you might have a doctor who wants to do an endometrial biopsy. They want to collect some of those cells, have the pathologist look at it under the microscope to say that the uterus looks healthy. And when I say healthy, I mean there's no precancerous or cancerous cells going on in the uterine lining. Okay, so what can you do about it? Well, after you've journaled and tracked, that's really helpful. Maybe check some lab work and imaging or done a biopsy. It's time to see if we can improve this. Now, you don't have to do anything if it's not causing anemia or fatigue or bothering you. You don't have to do anything, but there are some things that we could do to either slow or halt the bleeding. The first is using a progesterone releasing IUD. So pretty much any IUD or intrauterine device except for the copper non-hormonal Paragard. That's going to give you heavier bleeding. So absolutely a no. Now, the progesterone releasing IUDs are a really great option because they've been shown to really slow or completely stop bleeding. The way they do this is that the progesterone that's being released from the IUD is only staying in the uterus. You're not getting systemic levels of hormones. And that progesterone over time is thinning the lining of the uterine wall, which means there's just nothing that builds up, and hence there's nothing that needs to come down. So I always say, what goes up must come down. If there's nothing there and the lining's just really thin, you will have no bleeding. Or if there's just a little bit of a lining in your uterus, you might have scant or very light bleeding. Now, an IUD is wonderful for perimenopause, and I have a whole video here I did a while ago on why IUDs can be great in perimenopause, but they can also make the use of postmenopausal estrogen very easy, because if you're taking estrogen to control symptoms like hot flashes, night sweats, you already have a progesterone in the uterine lining, and so it's a great matchup. You could always consider the use of birth control pills. Now, I know that might sound crazy. Maybe you've already had your tubes tied, or your partner's had a vasectomy, or you don't have a male partner, but I do like to use birth control pills to actually control the bleeding, not just to prevent contraception. In fact, birth control pills, although obnoxiously named that, have many other benefits. So a birth control pill, when you take either 4 days off in between or you use continuously, meaning no placebo pills, can also help reduce bleeding. Actually, on that topic, any progesterone releasing birth control, even a depot shot or the Nexplanon, can also sometimes stop bleeding. For many of my patients, they've had their fair share of years of birth control and they might not want to go that route. So another thing you could actually do that I do quite often in perimenopause is use postmenopausal doses of progesterone. My favorite way of doing this is called Prometrium or micronized natural progesterone. It can have a couple of benefits. First, it can help just give you some progesterone, which is kind of like the glue that holds that uterine lining together, and it can help reduce the bleeding. Now, it's not contraception, so it's not going to help prevent you from pregnancy, so you need to make sure if that's something you're worried about, you're doing other things. Progesterone can also make you feel a little sleepy and help you relax and sometimes calm anxiety. So it can be a really great aid in perimenopause. In fact, I did a whole video here on progesterone, and I've got a lot more in my perimenopausal playlist if you want to check those out. Okay, I've already made this video go way too long, but abnormal uterine bleeding in perimenopause is such a common complaint, and it is something that you can actually take control of. So I hope this video was helpful. If you found it helpful, please share it to a friend, post it on your social media, and subscribe to the channel. That's really helping me carve out more time to make these videos for you.